Laryngitis is a condition characterized by the inflammation of the larynx, commonly known as the voice box. Think of your larynx as a small structure in your throat that contains your vocal cords. The vocal cords are two small bands of muscle that vibrate to create your normal sound when air passes through them. But when you have laryngitis, these vocal cords become inflamed and swollen. They can't move as freely or vibrate properly, which causes your voice to sound different. Typically, it results in a raspy or hoarse voice, and in more severe cases, people may lose their voice entirely. Types of laryngitis. There are two main types of laryngitis: acute and chronic. Acute laryngitis is the most common form and usually develops suddenly. In fact, acute laryngitis accounts for roughly 50% of cases where individuals seek medical help for voice issues. It is often linked to viral infections, like the cold or flu, and lasts for a few days to about 2 weeks. Most cases of acute laryngitis are temporary and improve with rest and home care. Chronic laryngitis, on the other hand, lasts longer than 3 weeks. It's usually caused by ongoing irritation or more persistent problems that need specific treatment. Causes of laryngitis. Laryngitis can be triggered by a variety of factors, ranging from infections to lifestyle habits. Number 1. Viral infections. This is the most common cause of acute laryngitis. When the respiratory system is affected by a virus, such as the common cold or flu, it can spread to the larynx, causing inflammation and irritation of the vocal cords. Number 2. Vocal strain. The vocal cords are muscles, and just like any other muscle, they can become fatigued and irritated if overworked, leading to swelling and inflammation. Overusing or straining your voice can lead to laryngitis, especially for individuals who speak loudly, shout, or sing for extended periods without proper vocal rest. Teachers, public speakers, and singers are particularly prone to vocal strain. Number 3. Gastroesophageal reflux disease, GERD. GERD is a condition in which stomach acid flows back up into the esophagus and throat, causing irritation and inflammation. When acid reaches the vocal cords, it can lead to chronic laryngitis. People with GERD may experience heartburn, a sour taste in the mouth, and frequent throat clearing, along with changes in their voice. Number 4. Smoking and exposure to irritants. Smoking is a major cause of chronic laryngitis. The chemicals in tobacco smoke irritate the lining of the larynx, leading to long-term inflammation. Additionally, secondhand smoke, air pollution, chemical fumes, and dust can also cause irritation in the throat, leading to both acute and chronic laryngitis. Number 5. Allergies. Seasonal allergies or allergies to environmental factors like pollen, dust, and animal dander can cause inflammation of the throat and larynx, leading to laryngitis. Number 6. Excessive alcohol consumption. Alcohol is a known irritant to the mucous membranes and can cause inflammation if consumed excessively, especially when combined with other factors like smoking or shouting. Symptoms of laryngitis. The experience of having laryngitis can vary from person to person, but there are some common patterns in how it feels and develops. Initially, you might notice your throat feeling a bit scratchy or irritated. This often progresses to hoarseness or changes in your voice, which is the most noticeable symptom. Your voice might start breaking or cracking when you try to speak. Some people describe it as sounding like they're going through puberty again. In more severe cases, you might find yourself barely able to produce any sound at all, just a whisper or a rough, croaky noise. The throat often feels raw and tender, especially when you swallow or try to speak. You might have a constant urge to clear your throat, though this actually irritates it more. Some people experience a dry, tickling sensation that triggers coughing. Sometimes you'll feel mild discomfort or pain when speaking or swallowing. Your neck might feel tender, and you could experience a sensation of fullness or pressure in your throat. If your laryngitis is part of a broader infection, you might also have typical cold symptoms like mild fever, body aches, and fatigue. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of laryngitis. Diagnosing laryngitis usually starts with your doctor listening to your symptoms and examining your throat using a small mirror and a light. During the examination, your doctor will probably ask you about your symptoms, how long they've lasted, and what might have triggered them. They want to know if you've been sick recently, if you use your voice a lot for work, or if you've been exposed to any irritants. In most cases, laryngitis is diagnosed based on the symptoms and physical exam alone, especially if it is short-lived and linked to a viral infection. However, if your laryngitis lasts longer than 3 weeks, or if your doctor suspects something more serious, they might recommend seeing an ear, nose, and throat specialist for a more detailed examination. An ENT specialist may perform a procedure called direct laryngoscopy. In this procedure, the doctor uses a tool called a laryngoscope, which is a thin, flexible tube with a camera at the end. This tube is inserted through the nose or mouth and guided down the throat to get a more detailed view of the larynx. This helps them see how swollen they are and check for other problems that might be causing your symptoms. The procedure may require a local anesthetic to numb the area and reduce discomfort. Treatment for laryngitis. The treatment for laryngitis depends on what's causing it and whether it's acute or chronic. Most cases of acute laryngitis improve on their own with rest and simple home care steps. The most important treatment for acute laryngitis is resting your voice. Avoid speaking or whispering as much as possible to give the vocal cords time to recover. Whispering in particular can strain the vocal cords even more than speaking normally, so it's best to rest your voice completely if possible. If you must speak, try to do so softly and for short periods. Hydration is another key in soothing the vocal cords and reducing inflammation. Drinking plenty of water keeps the throat lubricated, helping to ease discomfort and prevent further irritation. Warm fluids, such as tea with honey or warm water with lemon, can also provide relief. The warmth relaxes the muscles around the larynx, and honey helps coat the throat, reducing irritation. Many people also find relief from warm saltwater gargles, which can help reduce swelling and provide temporary comfort. Throat lozenges can also help by stimulating saliva production and lubricating your throat. Another key treatment for laryngitis is humidifying the air, which can be very helpful, especially if you're in a dry environment or using heating systems that dry out the air. A cool mist humidifier is often recommended, and placing it in your bedroom while you sleep can provide significant relief, especially if you wake up with a dry throat. For chronic laryngitis, treatment focuses on addressing the underlying cause. If acid reflux is the culprit, your doctor might prescribe medications to reduce stomach acid. When allergies are triggering your laryngitis, allergy medications or avoiding allergens might be recommended. If smoking or exposure to irritants is causing the problem, eliminating these factors is crucial for recovery. Sometimes, in cases where laryngitis is causing significant swelling of the vocal cords, or if you need to speak clearly urgently for professional reasons, corticosteroids may be prescribed. These are medications that reduce inflammation rapidly, helping to relieve hoarseness and discomfort. Corticosteroids can be taken as an oral pill or sometimes as an injection, depending on the severity of the condition. However, they're typically used only in short courses, as prolonged use can have side effects. In rare cases where bacterial infection is the cause, your doctor might prescribe antibiotics. However, since most cases are viral, antibiotics usually aren't necessary or helpful. Now, we want to hear from you. Have you experienced laryngitis before? What remedies worked best for you? And do you have any tips for managing it? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.